Okay. Hello, good afternoon, everyone, and welcome to today's Lunch with Cerevic session on what national data tells us about migrant youth mental health in Canada. My name is Sushmita. I go by Sushi. I'm the comms coordinator here at Cerevic, and I'm really excited to welcome Dr. Mauricio Coronel-Villalobos today. He's our speaker for the day and a research associate at UBC, specializing in research methodology, psychometrics, and youth mental health. His work applies quantitative methods to research on mental health, substance use stress, and sexual health among diverse and underserved youth populations. Today, he will share national findings on migrant youth mental health from 2014 to 2022 and discuss what they mean for our practice. Feel free to add your questions in the chat or introduce yourselves in the chat. And with that, I hand it over to you, Mauricio.
Thank you, Sushi, and welcome everyone. My name is Mauricio, and I'm going to be sharing the work of our awesome uh, team of co-authors. So I've included the names. Thank you, everyone, for your hard work in bringing this together today. So I'm going to be telling you a little bit about what we've seen around mental health in migrant youth. So it is a higher risk for migrant adolescents, or rather, migrant adolescents are at higher risk of encountering certain challenges in their mental health compared to other youth around their age that were Canada born. Some of these discrepancies include depression, anxiety, suicidal thoughts. So there's bigger risks of having any of these experiences happen to them. Um, and in the panorama for mental health, there's a lot of barriers of access that may prevent them from getting some help or some support. Some of these barriers include being unfamiliar with the healthcare system, navigating the processes, the bureaucracy, the paperwork, um, where to find healthcare providers, where to find resources, and so on. There's also a lot of stigma around mental health issues. Um, and there is some mistrust of healthcare providers. So sometimes youth that do know that these resources exist may not access them because they feel that it's not for them, or that they don't really need them, or they don't want them from the people that is available. So in general, there's a few barriers that make these youth less likely to access healthcare that might help. So for the study, we use the data from the Health Behavior and School Age Children Survey, HBSC for short. Um, there were 3 survey years from 2014, 2018, and 2022, with a total of 76,856 students. So that's a lot of people. Um, this was the survey took place in Canadian public schools between grades 6 and 10. And this survey takes a look at a lot of health situations, experiences, describes some of the life and environment and their experiences. So we are going to focus on the mental health portions of this, and we're going to look at youth who were born outside Canada and youth who were born in Canada, specifically boys and girls between grades 6 and 10. The Between the various questions that are related to mental health, 5 were chosen to take a look at how that has changed across 10 years. So the first one was overall health, which was described poor, fair, good, and excellent. And we split that in between poor and fair and good and excellent to make a distinction of those that were describing a negative health outcome and a positive general health outcome. Um, there was also life satisfaction. Out of 10 points that were presented to youth in a ladder, they were asked to point out to rate their life satisfaction from 1 to 10. And those that selected 9 or 10 were picked to indicate high life satisfaction. Um, we also looked at self-confidence in a five-point scale from strongly disagree to strongly agree to rate how they felt about themselves, if they were self-confident, how self-confident they felt. And we selected the 4 and 5 for those that were high self-confidence, which is what we were expecting to see or what we would like to be the general result. Um, we also looked at frequent health complaints. This is psychosomatic symptoms, physical symptoms that youth were experiencing, such as headaches, nausea, dizziness, sweating from anxiety, and so on. So, health complaints that they reported having experienced um, two or more symptoms of the possible list of symptoms in at least twice a week or more during during the past 6 months before the survey. So anyone that was above that was indicated as having frequent health complaints for having that health concern. And feeling of sadness and hopelessness. So um, just the frequency of how often they were feeling sad or hopeless. And for those that responded that they were experiencing these almost every day for 2 or more weeks in a row, were marked where was the indicator for having a lot of these feelings of sadness or hopelessness that would be too much. So to look at these mental health indicators over time, we use logistic regression analysis, which is going to let us uh, look at how likely youth are to report these outcomes. And when we put it with the years, and when we put it with the born in Canada versus not born in Canada youth, we're able to identify if there are any big changes over time. So we have 10 years of data. So we're going to 8 years, sorry. We're looking at how these changes happen over time, whether it has gone up or down. Is the mental health of migrant youth having significant changes? Are they more hopeful? Or are they having more health concerns and so on? We're also looking at disparities between groups. So, were there any particularly big gaps where migrant youth were more likely to report good health, or were Canadian-born youth more likely to report more stress and so on? So, we're looking at how in each of the 3 years that we had survey data from, were there any particular disparities between them? And we also looked whether these disparities, if there were any, changed over time, if there were any gaps that got bigger or smaller. Um, Ideally, we would hope for things to get better over time and for there to be no gaps, or if there's any gaps, for them to decrease for the better. So that's kind of the expectation or what we would like to see. But let's take a look at how this went with the data. When looking at overall health, most youth reported that they had good or excellent health. And you can see in the charts how most of them are kind of very high up in the 80 to 90% in 2014. And then we can see in the red line youth who are not born in Canada, and the blue line is those who were born in Canada. And we have the 3 year points, so 2014, 2018, 2022, and we can see that path. So it's a bit immediate to see that over time the line tends to be going downwards. So this is telling us that over the years, youth are less likely to be saying that their health was good or excellent. And this is true for both boys and girls. You can see that in 2018, there's a small gap for girls. So that's telling us that there was, for that year, a difference where youth who were born in Canada were more likely to report good or excellent health than migrant girls. But then in 2022, this disparity caught up from the change over time. Similarly, we're looking at life satisfaction, not as high as general mental health. Um, we look at how this changed over time seems to be decreasing overall, not as dramatically, especially for boys born in Canada. This doesn't seem to be that big of a decrease in the first year, but then you can see how it's just tending to a lower overall frequency of good or excellent life satisfaction, or 9 and 10 in life satisfaction. In 2018, we do see a similar gap for boys, where boys born in Canada were reporting higher life satisfaction for a while. But we see that that small gap disappears by 2022. When looking at self-confidence, um, if they felt confident in themselves, how much they agreed with having good self-confidence. We also see a bit of a decrease overall. We can see how boys were reporting between 70 80%, and girls were uh, about half of them were reporting high self-confidence, and this is going down over time. Um, there's not a lot of differences either between um, youth born in Canada and youth not born in Canada. And in 2022, we see girls um, having a bigger deep. Those that were born in Canada had a bigger decrease than those who were not born in Canada. So that made a gap appear that wasn't there before. When looking at health complaints, the frequency of them reporting multiple symptoms over a long period of time, we can see that this has gone up. Uh, Overall, uh, girls had more frequent health complaints over a long period of time than boys. And we can see that youth born in Canada were also reporting a larger number of health complaints overall. Um, for Canadian-born boys, we see a bigger increase, whereas the health complaints for girls are on a more stable trajectory upwards. Um, and we can also see that migrant youth are less likely to have these health complaints, whether boys or girls, so that disparity is shown. More so in the frequency than how likely they are to report this, but it's still um, showing that difference on how often they were reporting health complaints. Looking at reported feelings of sadness and hopelessness, we see a small increase over time for girls, not so much for boys. And we see that overall they seem to be reporting about the same um, general feeling of sadness or hopelessness, not particularly different whether they were born in Canada or they were born outside of Canada. And there's no bigger discrepancies on frequency, whether for boys or girls. Girls had some 30-ish%, boys had 20-ish%, but that's not particularly um, large increase. So overall, we saw that um, generally mental health seems to has gotten a bit worse from 2014 to 2022. We did see that migrant youth reported overall less health complaint than their peers. They tend to be resilient or less likely to express lower mental health complaints. But we didn't see any persistent gaps between youth born in Canada and migrant youth. So they tended to be experiencing the same mental health uh, results, or their experiences tended to be similar overall in across Canada. We presented these results to youth advisory to ask them what they thought about this, if they had some insights, and if they could give some context on how that looked within their own experience. And some of the things that they told us is that migrant youth tended to underreport mental health concerns, that they put less emphasis on mentioning if they had some mental health issues, if they felt too stressed or too tired or something. There was a fear of being stigmatized, that they didn't want to be perceived as viewed negatively, or that they needed more help than others. Some reported preference for a more traditional approach to health, and more culturally informed or based on their background. But they also mentioned that there was a growth in the use of social media for getting information, for getting support, seeing videos and clips and shorts of different mental health situations, that they were creating awareness, that they were putting voices out there, that it was making it easier for people to realize that the things that they were experiencing weren't uh, things that just happen to everyone, that some of these things may be of concern, or are things that could be addressed to improve their quality of life. And of course, they mentioned the impact of COVID-19, that of course in 2020 and the years after that, there was a lot of health impact, that they had a lot of experiences that made things difficult. So you can see that jump from the previous year to 2022, that dip in mental health did have a big lasting impact, but also generated a talk about health. They generated that consciousness about putting emphasis on self-care, on putting attention to themselves, and realizing that it's important to identify the situations that they can be addressed. So some of the recommendations for improving the access to healthcare, to make it easier for people to get additional resources and support, is the increase of accessibility of mental health services. One of the things is the concerns about cost. Not everything is included in healthcare. Some of these are um, also from not necessarily knowing if certain things are covered, if what are the supports and what are the resources that are available and at what cost. There's also the ability to access them physically. So they might not be placed in a place that is easily accessed for some people. They might be too far, or they might be in a place that is hostile. Um, in the sense of getting there is a lot of effort that might not be easy for them to get to. Um, Also, the importance of making these spaces culturally safe and inclusive, that is respectful of the youth's general culture, their background, their beliefs, their sense of self, that they have to have spaces that are able to hear other people, that are not too centered on a specific way of doing things, but also are inclusive of all youth. The confidentiality supports are also very important. Having confidentiality, to have that assurance that the people helping or providing resources are anonymous, that minimizes stigma, that makes them feel safer, to encourage youth to use the services without feeling that they're exposing themselves or marking themselves. Um, and overall, encouraging conversations of mental health, the importance of putting information out there in a way that they can hear and engage with, to reduce the stigma, to get conversations going, to be able to identify what things can be made better, and youth-informed resources that are approachable, that are in a way that the message gets across and not just put up there and just kind of glossed over. So overall, giving more encouragement, getting conversations going, giving access, and letting youth know that these services are there can make healthcare more accessible and improve their general well-being. Thank you.
Thank you, Mauricio. That was right on time. Um, does anyone have any questions that they would like to ask either in the chat or feel free to unmute yourself, ask questions, suggestions, comments, anything? Sometimes silence just means it was pretty clear. I know that we have your co-authors here too, so is there anything that anyone wants to share? Yes,
So
Ela.
she,
Oh,
sorry, I can wait, but that's okay.
Shams, go ahead.
So I have a question, Mauricio. Since I think you are one of the experts who worked on the topic, and you actually have engaged in different research projects around mental health migrant youth. And I appreciate you sharing the data around or the national data about migrant youth and mental health. Maybe my question is slightly beyond Canada, but I'm curious to hear your thoughts. Like I wonder if you have the impression that we might have a similar sense from migrant youth, let's say, who live in the US or who live in geographic locations where they are very close to the Canadian environment. While at the same time, maybe from a geography wise, it's close, but I know it's with the slightly different struggles when it comes to geopolitical conditions. I'm just
Mhm.
curious to hear your thoughts. I hope my question is clear.
I think so. Um, it's kind of difficult to make a general statement. The further we get away from the data that we do have, which is Canadian surveys, the harder it is to give a generalized, informed opinion. But we do have a lot of contact with our neighbors. Uh, and we do see and we hear a lot of comments on the difficulty of addressing mental health as a whole. But we also get a lot of communication, and especially through the globalization of social media, the instantaneous messages that get across, even when putting that constraint of language. We do hear a lot of increase on talks about mental health and what constitutes mental health. It's a bigger movement of understanding mental health. So, in a sense, conversations have gotten bigger about what is mental health, the importance of mental health and well-being beyond the physical symptoms. Um, so, when we start thinking, oh, this thing is a concern, then people start noticing, oh, wait a second, these things are experiences that I internalized as part of just everyday living, and turns out, hey, maybe I should talk to someone about that. So that's one of the things that we start seeing a rise in identifying these things. Sometimes we get that bigger reporting because these are self-report measures, but there's also the importance of global scale events. Um, COVID being a very frequent topic of conversation in the past few years of how health has being affected by it, physical and mental health. Um, so there is that optimist and that I'm subscribing to, that there's been a lot of work, there's been a lot of talks around mental health and its importance and its spreading. and youth are very on top of this. There's been a lot of conversation. So there's been a lot of trends of things feeling worse, and there's a lot more conversation around it. And um, in a sense of addressing things, if we close our eyes and we don't talk about it and we don't address it, things are going to stay stagnant. But the moment we uncover the lid and see how things are, that gives a lot of room for improvements and being able to address things.
Absolutely. Thank you, Mauricio.
Mauricio, thanks for this presentation. I had a question I think I realized that my two questions are really one question. So I was really intrigued by that difference in the Canadian-born youth being more willing or reporting more health complaints. Um, and then also the sadness and hopelessness for boys, how flat that line was, even though we hear so much about like the loneliness of adolescent boys and young men. And I'm wondering to what extent, if you're willing to speculate, you might think that both of these are driven by willingness to report. To what extent do you think it's a phenomenon versus a willingness to report the phenomenon?
That's a great question. Part of the problem with self-report measures is that there's always that subjectivity of how do you consider this? How good or bad do you think this is? So the best measure that some tend to have is comparing oneself to others, and what you hear and what you expect yourself. And there's a lot of theory around environment and self-perception and the precision of measurement. Some of these measures are really hard to put into numbers because it's so abstract to put into, tell me from 1 to 10, how much do you feel stressed? What is a 10 stress if you've never seen that? Um, but we do use the grand scale of the more information that we get from everyone, the wider the sampling, the more statistical rigor that we put, we're able to make bigger comparisons, especially when we're talking over time. We're looking at how they were reporting themselves to be at this point in time. So in this case, 2014, and compared to those that participated in the survey in 2022, is this there are they saying more or less the same thing, regardless of how objective, and I'm using this very loosely, how objective they're responding to this. We are making broad statements based on the general responses. So that's why it's important to compare within peers as much as possible to see how this looks in context.
That makes sense. Thank you.
Sorry, I was on mute. Dan, I know you
Oh,
have your
it's all
hand up.
good. So just to build on what Mauricio was just saying, I think this is one of the instances where having a youth advisory really helped give context to the findings and really helped flesh out what we had been seeing in the data. Because one of the things that didn't make it into the paper, maybe it's another paper, but one of the youth used this quote about saying, in terms of self-perception, that migrant youth have become the blueprint, or migrant youth have been more centered. So some of the youth in the youth advisory were commenting on how when they watch TV or movies or things like that, they're no longer seeing minority or people who are non-white. They're not occupying the peripheral positions anymore in popular media and culture. And I think that was interesting that one of the youth brought that up during the youth advisory group. And of course, I agree with what Mauricio is saying, but I think it's also a spot of optimism that they are identifying that with regards to the findings that we're seeing.
I have a question. Of all of the findings that you all reported, if I asked you if there was one finding, only one finding you could talk about, which one would it be? It could be something that surprised you, or it could be something that meant the most.
Hmm. Uh, I'm of two minds. Um, the shortest uncontextualized version of results are mental health overall got worse or trended for the worse. Um, However, I don't like to think of data results without that context of why are things changing like this. I think that there's a lot of positivity in seeing that um, youth that are born in Canada and youth that come to Canada, regardless of what age they come, um, tend to have similar experiences. There's a lot of research out there that um, looks at big gaps where one of the groups tends to have it much better or tends to have an easier experience or have more research or so on. And I think there's a note of optimism to think that at least in this small cut of the cake, we're seeing a lot of parity between youth. Um, so
Yeah.
I'd like to focus on that part rather than the things are getting worse because it doesn't really paint the full picture.
Yeah. Yeah, for sure. Thank you, Mauricio. Does anyone else have any questions, comments, concerns, suggestions? Not sure about the concerns part. Okay, great. Thank you again, Mauricio, and thank you everyone for attending today's session. We'll see you all next month, third Thursday. Thank you.
Thanks, everyone.
Thank you.
Thank you.